PRP plus ECM injections for hair loss in 26-year-old male. Hi, just looking for some information on platelet-rich plasma and extracellular matrix injections for hair loss. How well it works, how long it lasts, and what sort of costs am I looking at? From what I've read, it only lasts roughly 3 to 4 months, but longer in some cases. Would it be a good option to do this prior to starting minoxidil, or would that be a pointless waste of money? If anyone has experimented with it, I would love to hear from you. Thanks in advance.
Thank you for your question. You're 26 years old. You submitted several photos with your hair apparently wet, and you've done some research on PRP and ECM. And in the body of your question, you are clearly confused about the longevity and benefit of this type of procedure, and I can certainly assist you with understanding why you're so confused. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic surgeon, and I've been performing hair transplant surgery for over 20 years in New York and Long Island. I'm also the founder of TrichoStem Hair Regeneration Centers, and this is a system that we've developed over several years and that we're now expanded based on the work we've done with PRP and extracellular matrix. We have patients who come from all over the world, and we have extensive clinical data to give you some information that will be probably of some value to you. So first of all, let's understand your situation. At the age of 26, you have fairly diffuse and advanced hair loss, which means that there's a genetic pattern that is causing this to happen. In hair loss, we have a basic rule of decades where people in their 20s, only 20% of men will have hair loss, and that applies for 40s, 50s, where 50% will have hair loss. So given the early age of onset and the relative aggressiveness where we see a lot of your scalp, it's clearly you need something to stop the progression. Now, in our practice, we first started using extracellular matrix and platelet-rich plasma with the intention to help heal hair transplants better, improve the donor area healing, and improve the graft survival rate. Serendipitously, observations were made that showed thinning hair becoming thicker. That being said, I set out on a mission to develop a system to allow consistency. What you're seeing when you're doing your research is there are people who are doing it, but they're doing it with various of their own variations of different formulations and delivery methods. I can't speak to what other people are doing, but I can tell you what we've been doing. In the evolution of this procedure, we realized that in comparison to patients who had hair transplant, whether it was FUT or FUE, with the right candidate, because nature already has the hair in place, the results of hair injection or hair regeneration treatment actually exceeds the volume that you get from 2 transplants. And it's very straightforward. With extracellular matrix platelet-rich plasma and the way we do it, and which is customized to each individual based on our own clinical data and algorithms, we're able to stop progression and improve the volume and thickness, essentially reactivating growth cycles in a way that actually allows hairs to become thicker and not continue to thin. As far as longevity is concerned, we do have to customize it to each individual. With more than 5 years of data, with hundreds and hundreds of patients coming to us every year from around the world, we have enough data from people of all age groups to basically state a couple of essential guidelines. Number one, the earlier we catch somebody, the better it is. The more hair you have existing, the more likely you'll get significant benefit. The more further along you are, you'll still get benefit, but it won't be as much as someone who has existing hair. In the beginning, we were cautious about treating people in their 20s, but found that we were actually getting extremely good results because in the 20s and 30s, when people are starting to have this progression. Again, it does depend on the degree of severity and rapidity of progression. There are people who lose their hair by the time they're 22. They start at 17, 18 and lose their hair by the time they're 22. That's a very aggressive pattern. You have something that may be similar, but you still have existing hair. So the bottom line is the more hair you have, the better you'll do. As far as the longevity of the procedure is concerned, in our practice, we follow our patients every 3 months for at least 18 months. We do have a protocol where we do a second injection somewhere in the 12 to 18 month range that we can get even more benefit. It's not like the procedure wears off. It's that we're able to activate additional growth with the second treatment, and that's part of our whole treatment plan. After that's done, we follow patients yearly, and so far I would estimate that it could take maybe 5 years and possibly as early as 3 years before you may need another injection. We don't have enough data at this point to be able to define that completely, but we do leave our door open so patients are able to return as often as they need to. So in your situation, if you were a person who would come to our practice, I would say we would do the injection as soon as possible, and we would observe you and then probably do another injection to see if we can manage to get a little bit more benefit. Sustainability is important, and when people in your situation consider their options, there are the drugs, which are minoxidil and finasteride. Unfortunately, a lot of younger men who come to us don't want to take finasteride for concerns about long-term sexual dysfunction. And then on the other side of that, there's surgery. Someone like yourself would not be a good surgical candidate. I don't think you would do well enough to be able to obtain a good volume of hair. So that leaves us in this unique situation where we have something like an injection that, for argument's sake, if you had to do every 3 years, is much more sustainable than having surgery. So with that understanding, learn more about this method and our treatment and others, and learn from others who are doing similar things. But I think you can at least understand that this technology can have value that is much more long-term than the short term that you believed you had observed from other areas on the internet. So I hope that was helpful. I wish you the best of luck, and thank you for your question.